Miss Howell. I'm Nurse Taylor. I have doctor's orders to give you some IV push heparin to prevent some blood clots. Can I get your name, date of birth?
Ashley Howell, January 2nd, 2000.
Okay. Do you have any allergies, Miss Howell?
No, ma'am.
Okay, so I checked to make sure she doesn't have an allergy band and that her name matches her MAR. So, Miss Howell, I'm going to give this, as I said, to prevent some blood clots. And this medication, you may experience some stomach pains or some headaches. And if that occurs, just let me know. I'm going to be giving you, as I draw it up, I'm going to let them know that I'm giving them 1.6 milliliters IV push over 3 to 10 minutes. And I'm using my blunt tip to pull that up. And it's not the best practice to recap your noodles, but I'm going to needles, not noodles. I'm gonna swoop and scoop, and I'm gonna go ahead and check that IV site, make sure that it's clean, dry, intact, and make sure that I'm able to give this med. I'm gonna go ahead and unclap my IV site. Alright, so I'm going to clean off my port so I can push some saline, but I'm going to start off by connecting this to the port. I'm going to aspirate, and when I see blood, to make sure that I'm still in the vein, then I'm going to push 3 to 5 milliliters of my saline. Alright, and once I've done that, I'm going to take my heparin, and I'm going to slowly inject my heparin, my 1.6 milliliters over 3 to 10 minutes. Okay, so it's been about 5 minutes and I've given all my heparin, so I'm gonna stop and I'm gonna flush behind that the rest of my 3 to 5 mLs. Alright, I'm gonna clamp back off my IV site. Okay. Alright. So, before I gave this, I already had my PTT levels. So, to make sure that this heparin is working, I'm going to reevaluate, get those labs again, get that PTT. I'm going to make sure that my patient is not bleeding. And I'm going to reassess my vitals. And also, earlier they're getting Unison, and I made sure that the heparin was compatible with the Unison and with my saline. And there's no issues to give that. Also, to check for the signs of bleeding, you can look for in their gums to make sure their gums aren't bleeding, in their nares. Just make sure that this patient is not bleeding out while on heparin. And make sure to document the IV site, the way they took it, and the PTT levels, and that's all.